Hi, I'm Shamik Bafna. I'm one of the eye doctors over at the Cleveland Eye Clinic. Glaucoma is a very common eye problem that affects patients because they have elevated pressure inside the eye. With that elevated pressure, it tends to affect the optic nerve and can eventually lead to visual loss. Most patients are treated with eye drops for their glaucoma, but eye drops have a lot of issues with them. Number one, it can be very hard to remember to put the eye drops in the patient's eyes. I mean, many times when I talk to my patients, they're supposed to be using them regularly, but they'll oftentimes admit that it's commonplace to forget putting the drops in once or twice a week. And like anything, I mean, we've got busy lives. It's very, very hard to remember putting in drops inside your eyes. The other issues is many of these drops, besides the benefit of lowering pressure, can cause a lot of irritation in your eyes. And the last issue oftentimes with drops is cost. I mean, there is a cost effect, and many times the drops are not covered by the patient's insurance, and it can be a problem where once you get started with drops, it's something you have to keep taking the rest of your life, because there's unfortunately not really a cure for glaucoma. It's just like blood pressure. It's something that we have to control with eye drops. Well, what's nice is these days we've actually have interventions or procedures that we can provide our patients that can reduce their dependency on drops. What is DSLT? DSLT is a procedure that takes less than 3 seconds as opposed to 4 minutes. It is something that has an automatic eye tracker on it, and with that we're able to go ahead and apply 120 spots of light energy in less than 3 seconds. What's nice is the patient can drive home the same day, and it's a procedure that's typically covered by the patient's insurance. We've also learned over time that when we've compared patients that have DSLT or SLT, they actually do better as far as their glaucoma is concerned as opposed to eye drops. So it's actually better for you to have these type of interventions. There's other interventions that are available also to help lower the patient's eye pressures. There's another procedure that we can do in the patient's office known as Durista, where we place the medication as a extended release medication within the eye, and it releases it over maybe 6 months to a year or 2 years worth of time. There's also another procedure done that we do in the operating room called iDose, and that's where we go ahead and place travoprost, which is the same thing as Travatan. It's a very common drop like latanoprost, and it lasts for over 3 years. We're really in a very, very exciting time where in the past we only had drops as an option for our patients, but these days, through these different modalities, we can go ahead and reduce a patient's dependency on the drops. If this is something that sounds of interest to you, and if you'd like more information, contact us at the Cleveland Eye Clinic. Thank you.